Hi everybody, this is Dr. Premanand here. Today I'm going to have a brief discussion on beard transplant. So which is a very unique when compared to the hair transplant. So hair transplant is done in so many places and it is very commonly done even by non-medicals or even by some technicians. But when it comes to a beard implant, you need a very highly trained and skilled training in this or the specialization in this to understand, because the major difference is when we are doing a hair transplant, we are dealing with the scalp. So your hair pattern or your hair insertion or the your donor side, recipient side is all completely different, and it is much more easier to deal when it comes to the skin. So here we are dealing with the skin, not with the scalp. So when it comes to the beard transplant, that the donor side, from where you're gonna get the hair is very important. Usually from the chest or from the back, we take these grafts. So the uptake of these grafts or the placement of these grafts, you need a very high level skill training for this. And then the growth pattern and the skills of how we are going to implant this makes a whole lot of a difference. This takes around 2 to 3 hours, unlike the scalp procedures, which takes more than half a day. So here we can do it in 2 to 3 hours. So the costing doesn't go how we do it with the in case of the scalp or the hair regular implant. So because there the number of follicles are very high, so the charges differ. Here the follicles will be very less, but the technique and the skill level is very more precise than the scalp techniques. So here the charges goes according to that, and when compared, it's almost the similar, we can say, with the beard or the regular hair transplant. So here, as I said, the techniques are very different. So we use different extractors or implanters, or this is all we have, the Swiss imported ones. So where there is a scarring is very minimal, because this is a face. So you need to be very much careful on the scarring or on the implanting area, so that we don't have any hyperpigmentations or any other skin related issues because of this beard transplant. And the uptake of graft is almost more than 90 to 95%. So where they will have a regular growth, and it will be there will be no difference between the natural growth and the implanted area growth. And this could be suggested for especially in the teens or the young adults, where they have a lot of stigma in the society that they don't have a hair on the mush area or on the beard area. So these individual cases can be focused, and they could have a permanent solution, and they could be very confident in their life. And the merging of the implanted area and the natural area is very natural, so that they'll be very confident on it. And there is very minimal downtime, so the post-op care would be given in a printed format after the procedure, and including the maintenance how they have to do. So there is no much downtime, or there is no dressing, or there is no big cover on the face so that they cannot move out. There is nothing like that. Only thing, they need to keep away from the pollution and have a good care post-operative, so which would be given in a printed format, and it is very simple to follow. So there are very minimal complications, or what you call as desired results. So because it's on the face and it is very noticeable, so there could be some sort of minimal, undesirable results sometimes, like with the hair growth pattern or the hair quality, the thickness of the hair, because the transplanted hair could be different from the natural hair. So this could be one of the complications what we usually come across. But here what happens is, depending on the grafting techniques and where we graft these areas, which camouflages the transplanted hair with the natural hair, makes whole lot of a difference. So as I said in the beginning, the technique or the skill level is very important to camouflage these things. So because we cannot 100% match the natural hair, so we need to camouflage. So the doctor or that the skill level makes whole lot of a difference how we give a beautiful outcome. And here in our case, we are showing in our video, you can see how this is done and how happy this client is satisfied with it. So it all depends on the technique of the implanting, where we can minimize the risk or minimize the complications and avoid the undesired results. So I would suggest the young adults or anybody who has this confident issues because of the less beard or the mush, they can come try this unique technique with us and have a confident smile and lifestyle what they look for. Thank you.